All right, so we'll start with what you do. So, doctor of physical therapy,
Yes.
and then the clinical exercise physiologist. So, we'll just go ahead and describe what you do, the people you work with, and why you enjoy it so much. So, just you.
Okay, so I'm a doctor of physical therapy. I've been practicing since 1996, and I really specialized about 11 years ago. I took my first myofascial release class, and it changed the way I practice. So now I do a lot more manual therapy, and I still do therapeutic exercise with my clients, but that's more for them to do at home, and I spend more time one-on-one with my hands on the clients doing both myofascial release and also craniosacral therapy.
So, what was that like aha moment when you said that took you learning more about the fascia and changing your practice? What was that kind of like aha moment for you? Was it in that course or?
No, it was more when you take the information that you learn and you go back to the clinic on Monday morning and you start working with clients and you're starting to get results and they're jumping off the table pain free and they're calling it voodoo and witchcraft and and they're asking for that again and again. Can you do what you did with me last time? And I had relief for so many days and now it's back a little bit, but it's nothing like it was. And so then you just sign right up for your next class.
Right. And then so you've taken that and that's now become the main foundation.
That, yes. Without that, I wouldn't have opened my own practice. That's what really sets me apart and all manual therapists apart from your traditional physical therapy, which also has a place. I don't want to say that traditional physical therapy with Therex doesn't have a place, and the clinics that you go to pre-op and post-op definitely has a place in the healthcare system. It's different, and it's more about you had your surgery and you haven't recovered the way you thought. Now your physical therapy is over and you're still in pain, so it's more for that chronic and unexplained pain is a little bit more the focus of manual therapy.
That was something when I connected with you is I love professionals in their field but work a little more non-traditional, right, in a non-traditional settings. I was just in a meeting last week and trying to explain what it is that I do and why it's so non-traditional and unique even for my setting. And a part of that is even in the physical therapy realm, it's almost created a spot for me, especially in the clinical setting. And how you were describing, there is definitely still a need for that. But what would you say in your, being a physical therapist in your line of work, what's one kind of like fault in the system or working in that traditional setting?
Oh, that's easy. Insurance. The insurance companies dictate everything. They dictate how many visits we can have and what therapies we can do and what's going to be approved and what's not going to be approved. And yes, 100% the big folly of the medical field today is the insurance companies. And it's really what also led to me opening my own practice, was just wanting to practice the way I want and not being able to because insurance companies wouldn't pay for that.
Right. And therefore you're allowed to now use all of these different tools and see those outcomes, like the myofascial, to benefit the patient. So you work a lot with the fascia. Can you explain on your end what that is to all the members? What fascia is and why that can be so important in their recovery?
Okay, so fascia is your connective tissue, and it surrounds every blood vessel, nerve, muscle. It becomes your tendons and ligaments, and it also incorporates the ground substance, so it surrounds every cell. So when that fascia is tight and restricted, it can not only pull you off with your posture, but it can press on pain-sensitive structures if it's tight, and it can also impede circulation to different areas of the body. So now you have a buildup of waste product, and you don't have good nutrition coming into different areas, different cells. So then you have the formation of disease processes. So when you release that fascia, it improves your circulation, it improves your posture, it improves the way all of your muscles and nerves and bones are aligned so that you can regain your best functional patterns.
Yep, yeah, absolutely. And in my term is we want to create pretty much at the end of the day is increase circulation, decrease inflammation. Right. So when it comes to fascia, we want that integrity to be quicker, right? The communication along all of the tissues, right? So a lot of what I educate on is being able to optimize that, right? So whether it's scar tissue, what that barrier may be, is how can we take someone, what am I trying to say, is how does someone understand that they may have this
restriction?
Correct. How would someone know that, oh, what I'm experiencing is fascia related?
Well, what we look for is anything that is hard, hot, or tender.
Okay.
And all pain comes from inflammation. So if you're having pain, there is some level of inflammation going on there. So just in that, you can be like, okay, my hip hurts. There's probably a restriction in there that is causing the inflammation or preventing the inflammation to clear out of my system.
Right. And that starts with, so when you work with a patient first, that starts with a assessment, correct?
Correct, yes. And we're looking for hard, hot, or tender. And you can also feel the body patterns, and it also starts as soon as somebody walks in the door. And it's an assessment happens every time they walk in the door. You're just taking a quick look and seeing how are things aligned, how is this person moving, every single time they walk in the door. And then you get your hands on them.
Then you get your hands on. And that's where the fun really happens.
Yeah.
So, what are some tools that you use for your practice?
Okay, so primarily my hands, but there are always times when my hands just need a little supplement. Like when you're dealing with really tight fascial restrictions that are a little bit more than my fingers can really get through, I might use something like my scraper here.
I love those.
I love this tool, and you're not supposed to, it's not the fascial blaster. Please don't use the fascial blaster. But this is used in a very gentle way, but it's just there to save my hands, and I can really get into like the side of your calves can get very, very tight, or your IT bands, I can use it very gently to assist with the myofascial release, but not replace it.
But not replace it. I love that.
And then I usually use that, I couple that because you don't want to go directly on the skin. I'll couple it with a coupling agent, and my favorite is CBD Clinic. I usually use the level 5, but there's also a level 4 that I like to use, and that just serves as the medium so that we're not, injuring the skin as we're scraping a bit.
Right.
The other thing I really like to use is the Dolphin. So the Dolphin uses, instead of like your TENS unit or what you would see in more of a traditional physical therapy practice where they put the pads on you, which is AC current, this uses direct current. This is DC current. And
this is the one where you have to close the circuit.
You close the circuit. With the Dolphin, we do want to close the circuit. I do have a new piece of equipment that I bought that attaches one wrist to my wrist to help close the circuit. But just to give you a demo of why we really want to close the circuit, electricity, this does not produce any electricity. It just picks it up. So if I'm holding on to it, it doesn't do anything. But if I close the circuit, it does. Yes, so then if she holds on to it, it still does nothing because the circuit is still open until we touch each other. Now we have a closed circuit. And the same thing is how we use these. So the electricity will go through the tip here, through the patient's body, through my body, and then back to the thumb plate here to close the circuit. So this is just helping with that connection of their body to my body, so I don't have to necessarily have my hand on them. But we can either go through your acupuncture points with these and treat your acupuncture points, your meridians, your chakras, and you can treat all of the organs of the body that way. The liver, the lung, the gallbladder, the spleen, everything is connected. through your meridian lines, and we can use the dolphin on those. Or the other thing that I really like to do is a scar release. So your normal healthy tissue has a negative charge, and then when you cut the skin and you have a scar, and that includes bone fractures and any kind of internal scarring as well, any kind of ripping, tearing that's gone on internally, it automatically becomes positively charged once that's been cut.
Mm-hmm.
So then you have a repelling of all of your positive ions like sodium, potassium, magnesium, calcium.
Important electrolytes.
They're all repelled from that area, and then through osmosis it takes the fluid with it, so you have very poor circulation through any kind of scar tissue. So we take these and we kind of stitch the negative polarity back and forth on either side of your scar and repolarize it from positive to negative. And it's a permanent change, although we might need to do it a few times. The change is permanent, and circulation can resume through that area in a more normal way.
And that's what, so we use the closest thing that I've used in my field was, and I think we've talked about it, so down at McDill we did magnetic ion beds.
Yes.
And that was really interesting. So again, coming down from my point of view is working whole body as the physiologist is again increasing that circulation and decreasing the chronic inflammation. And how do we get, right, that circulation to increase in injured areas? So that's where we try to work, and I try to work with specialists and able to do that. And then we had beds that you laid on and working with the ions and positive negative charging and really circulating that through a human body, down to compressed discs and injuries such as that, especially from military tactical athletes, is we see a lot of that. So being able to take those negative and positive ions and then pretty much help circulate it. And I think there's so much, it can get more complex, but on an educational standpoint is all of these chemicals, those electrolytes play so much more of an important role, especially when you are struggling with something that may be physically impaired, injured, pain. We want to use those types of tools that are not done in a traditional setting. The only reason I've come across those types of methods is working in higher end type jobs that fund and facilitate those types of tools and methods for those to help with their pain and relieve all of that. So it's neat to be able to see something like that can be done for the everyday woman.
Yes.
So that is what really, sold me, is all of these additional tools and techniques. And that's what I also want to shed light on, is that there are these resources. There's Kathy out there, and having her specialty and being able to use these, but being able to properly use this and these for each specific person.
It takes training. It does take training.
And a lot of time. I mean, it's taken you time, so much experience.
Right.
To, like you said, even when you first see that patient, that assessment is starting.
Right.
So, so thank you for that explanation. Keep going.
Okay, let's see, what else do we have? Oh, so for cranial sacral therapy.
Oh yeah, so explain, I did kind of explain a little bit just from one of my services that I had with you last, the cranial sacral therapy. And let me tell you, my hip, I've worked out twice now, lower body, and I'm okay. I've been walking, no, that clicking, popping. I'm still being cautious. I still don't want to progress too much too soon. But guys, I've had two services. And my hip pain-free as of right now, but I still have to do my due diligence too. But I was doing a brief explanation on the cranial sacral therapy, so dive into that next.
Okay, so with